There's an interesting piece that came out in Men's Health magazine, and it's called Here's How Dr. Fauci is Protecting His Immune System During the Pandemic. Now, of course, this is a really interesting article right off the bat because this is Dr. Fauci, the illustrious Dr. Fauci. What is he doing? I'm dying to know. And as we scroll down this article right here, we can see Dr. Fauci just enjoying a nice sunny day out in front of his mansion. And let me tell you, for 80-year-old guy, I was really impressed when I found out he was 80 years old. He looks great, and he's very active, so I'm going to give him that. He's obviously got some genetics on his side or done some right things throughout his life when it comes to making some good choices because, like I said, I know a lot of 80-year-olds. I give patient care to a lot of 80-year-olds, and very impressed to find out he's 80. But let's go ahead and take a look at this article because what Dr. Fauci says right off the bat is that it's very important to make sure that you're doing everything to ensure that you have a good functioning immune system, but you can't buy a good immune system. He goes on to say, if you don't smoke, if you only drink in moderation, you get a good night's sleep, you have a healthy diet, you exercise, and you do something to reduce stress, that's going to keep your immune system healthy. I agree with all of those things because they're incredibly important. Healthy diet, making sure that you get exercise. I talk about exercise and the importance of it. It's an essential nutrient for the body. Our genetics require exercise. So if you're not exercising, you got to get out and get moving. Starting with as little as a 30-minute walk a day is a great way to start implementing exercise into your lifestyle if you don't do it at all. A good night's sleep, I think that's incredibly important as well. And focusing on reducing stress. I was telling a patient the other day, I said, you have to find peace in your life because if you have too much stress, it's horrible for your cardiovascular system. But then Dr. Fauci, he goes on to say that not any of these dietary supplements and herbs and other things. So he's saying, all these other things are going to do good for you, but not any of these dietary supplements and herbs and other things. Like those are silly. Well, I don't agree with that. As a natural doctor, I have combed through enormous amounts of science over the past year, looking at how you can use different vitamins and herbs to boost your immune system. So interesting statement there. So you have to de-stress. That's where he goes on next in this article. You have to de-stress, and he says he goes out and goes for a walk every day, and it's a real important thing to him, and that's great. Get out in nature, and I think it's so important for clearing the mind and helping you, get grounded, and then, of course, get that movement and activity in. Now, he said, know the exceptions to the vitamins won't help refrain. Now, when Dr. Fauci mentioned in September that he takes vitamin D, and that's low levels of the vitamin affects your susceptibility to infection because if you have depleted vitamin D, your immune system doesn't function well. People heard, I take vitamin D as you should take vitamin D. Not how it goes. If you are deficient in D, then taking vitamin D supplements is important. If you have normal levels, it doesn't make any difference, he says. He then says, a doc can check your vitamin D levels via a blood test. Now, this is all correct, that a doctor can check your vitamin D levels, and if you haven't gotten your vitamin D levels checked, you definitely should, because one of the major factors that they find in people who end up in the hospital, or even worse, maybe even death, associated with COVID, will typically have a vitamin D deficiency. So you should take that very seriously. But he goes on to say, well, you know what? It's not that big of a deal. Everybody needs to calm down about this vitamin D thing, Whereas he really should have been saying it is incredibly important, okay? Incredibly important. And the other thing that he mentions here is, well, if you're not deficient, then it doesn't matter. Well, it does matter because at what level is the vitamin D in your body? It's like, if you have 1 point above having a deficiency, that's still pretty low vitamin D. But if you're 30 points over having a deficiency, then you're going to be doing all right. So you do have to make sure that you have adequate amounts, not just like hanging on that edge. So vitamin D at a good, healthy level in the body is very important versus vitamin D either at a low level or a depleted level. Dr. Fauci then goes on to say, start with a good breakfast. What does he think a good breakfast is? He says it's important to make sure that you're having a balanced diet and also a balanced breakfast. So he gets the day off to a good start with a pretty consistent, healthy breakfast, usually pomegranate juice, egg whites, and an English muffin. Okay, now I think Dr. Fauci wrote the book on the American Heart Association diet because this is basically one of those types of diets. As you can see, pomegranate juice, yeah, you're going to get lots of good nutrients and antioxidants, but it's just such a high sugar drink to have in the morning that I wouldn't recommend it. Egg whites, you can see that he pulled the egg yolks out because he's probably concerned about cholesterol there, which is, silly based off of science today. And then an English muffin, so he's getting those whole grains in. Okay, like I said, this is your typical low fat, whole grains type of diet. Not a fan of it. So pretty interesting as to how he looks at diet. But, he is 80 years old. He's kind of that traditional medicine type of guy. And once again, I'll go back to my original statement. He looks great for his age, so I can't pick on him for that. Next is going to be get adequate sleep, or at least take a nap. He mentions how basically with all the COVID-19 stuff, he has been, just going nonstop, and it was only averaging about 3 to 4 hours a night during the COVID pandemic outbreak. And so then he says make sure that you get your sleep up, which is a very important topic there in itself, because sleep is an absolute pillar to good health. And if you don't have good sleep, you can see that your health will deteriorate. You can take someone, for instance, who develops sleep apnea and they don't know it, and they start to just have bad sleep for years. You can hear their mental abilities start to decline as they talk. You can hear that, or you can see that they just can't get through the day well. They look fatigued. They don't look healthy. We have to make sure that we get good sleep. Keeping COVID-19 away, what does Dr. Fauci say to do? Wear a mask, wash your hands compulsively, make sure you sanitize, and also make sure that you're basically distancing from people. Now, I think that that's a very controversial statement, because when you look at masks, for instance, there's just as much evidence out there stating that masks don't do anything and also have negative side effects as there is evidence stating that it could potentially protect you from the virus. So that's a very controversial statement in the way of true science goes. The other thing that you got to be careful with is the over sanitation is not necessarily a good thing either. I talk about all the time how the excessive sanitation that people are using right now, covering themselves in antibacterials constantly, will have a pretty severe impact in people's health as we move on in time, because it was only, I think, last year that the FDA finally, which I had been saying this for years, they finally came out and said using hand sanitizers is actually bad, because this microbiome, these good healthy bugs on our body, actually play an important role. And as I mentioned, people are just covering themselves with hand sanitizer anymore because they believe that that is how they're going to protect themselves from COVID. So another interesting statement there by the illustrious Dr. Fauci. Currently, the U.S. has more than 250,000 deaths. We have to make sure that we do take into consideration that the CDC did change and flip the switch on how they count deaths in March of 2020. They actually basically changed the way that they count deaths, so that pretty much if you got hit by a car and you had COVID-19, it was a COVID-19 death. So when you actually look at how they would calculate deaths from a particular problem over the past 17 years, if you were to use that same method today, looking at COVID, the numbers would be far, far less. Like I said, they changed the way that they count the death toll in regards to a health problem in March of 2020. So therefore, it made the numbers with COVID deaths just absolutely skyrocket. And that's why when you heard of somebody who had died and they were in end-stage cancer, or if somebody died and they had severe crippling type 2 diabetes and they tested them for COVID, it was a COVID death versus a cancer death or a diabetes death with a factor of COVID that was further down the line as a secondary or tertiary factor. So it was then labeled as a primary cause. So there's a lot of controversial statements in here. And overall, we have to realize that vitamins do play an important role in our overall health. Okay, we cannot dismiss this. And it's not only vitamin D. You have to look at vitamins like garlic, zinc, vitamin A, vitamin C, and also vitamin D because they're all very good immune boosting vitamins. So take that seriously. And you should take COVID seriously. Don't misinterpret anything I say here that COVID should not be taken seriously or that COVID's not real or anything. You should take COVID very seriously, but it's also very important to make sure that you take a reasonable approach to it as well and a scientific approach to it.